All right, so this is the April 2023 MEC Minute, and today we're going to talk about service animals. With me is Lieutenant Barry Wright, who's going to participate in the conversation. And for those of you who are new to the group, or relatively new to the group, we have to acknowledge that Barry was our original EMS protocol coordinator back in 2009, 2010. A lot of water over the dam since then, but It's nice to have Barry back in the conversation. So we're going to talk about service animals, and on our agenda today is to talk about what is a service animal. We'll talk a little bit about service animal and a comfort animal. There is a difference. We'll talk some about EMS providers and what they can ask about the service animal. Then you are limited to some extent about the questions you can ask, and that's because of the Americans with Disability Act. And then we're going to talk about transporting a patient with a service animal versus a patient who's got a comfort animal. So a couple quick little comments. First off, Barry and I are not lawyers, so we're not going to try to answer all questions about all possible scenarios. But this is kind of like a working review of what I think we as clinicians need to know. The second thing is a lot of what we talk about with service animals is not a MEC EMS conversation or protocol or policy. It's really something that needs to be stated individually by each member agency. So whether or not your agency needs a policy statement or some administrative rule about service animals, I defer to your leadership to determine. So Barry, any comments so far?
No, this is a great topic. Those of you that don't know, I have a service animal. I tried for a couple years to figure out the process to obtain a service animal, and it is a lengthy process. So I was able to obtain a service dog back in December of last year, and she went through 8 months of training before I got her. And then she and I went through 3 months of training together before she was quote-unquote released, and then I took possession of her in late December of last year. So that's kind of why I'm a part of this today. So I've had a lot of trials and tribulations with her and myself as a learning curve for both of us, trying to figure out the do's and the don'ts. So hopefully I can just have some clarity on some of this subject matter going forward.
All right. So let's start with a couple cases for discussion. I'm just going to introduce them. You think about the questions asked, and we'll discuss these same 3 cases at the end of the conversation. So the first is EMS is called to the home of a patient with a complaint of dyspnea. There's a dog at his side, and the patient states it's his service dog and he wants it to go with him to the hospital. The second case is EMS is about to take a patient to the ED, and the patient asks to take her comfort cat with them. And the third case is a patient is hit by a car in the crosswalk and unconscious. Their service dog as well as a friend are uninjured. The EMS supervisor asks you to take the dog along to the hospital. So think about these 3 cases, and we'll talk about them again with our responses at the end. So what is a service animal? Well, the service animals are specifically covered by the Americans with Disability Act. The ADA has been out there for well over 20 years now. And service animals are covered by the Act. There are also rules within the state of Ohio that cover service animals, except I think they're called assistance animals.
Correct.
The ADA covers dogs only, with the exception of small horses, miniature horses, and I really don't know much about that circumstance, and I've yet to see one out there. For our purpose, though, a service animal is a dog that's been individually trained to work or perform tasks for an individual with a disability. Like Barry mentioned earlier, service animals or service dog takes months, if not years, to train, and the cost of training is quite high. So I believe the average cost to train a service animal is around $10,000.
Correct. When we started doing the research, it went from basically $10,000 to about $25,000, and that includes the dog, the training, and then ongoing training. She'll go back 3 times a year for training, so it's an ongoing thing. And as Dr. Zeeb said, that the animal is individually trained for the person. There's not a global service dog training program. It's obedience. Once they master that, then they take them into the specific type of disability that the patient or person has and train them as needed.
Again, service animals could include miniature horses in some circumstances. I'm still waiting to find that circumstance. The animals must be under the control of the handler, but they don't. We can't require them to be tethered or harnessed or leashed, or they must be tethered, harnessed, leashed, unless restraining the animal in that way interferes with their performance of their task. So, if the animal the dog is to go help pick up items for the patient, then a tether or a leash may interfere with their task. And these are working animals; they're not pets. So, my operating philosophy typically is with any animals, I don't approach the animal unless the owner says okay. With service animals, I really make that clear. I don't want to interfere with that function, and I'm really not sure if I should be interfacing with that animal.
Correction. And as a handler and the owner of a service dog, I appreciate that. And I probably have 96-97% success rate with that. But I do run into people who clearly don't see the vest and the decals on the dog's vest that says "Don't pet," but you just kind of take that with a grain of salt.
Yeah, and I don't approach any dog unless I ask permission.
Correct.
I don't know what the dog's personality is like. So some ADA specifics. A person with a service animal cannot be excluded from any location of service that is open to the public. Really, what this is saying is you should treat the patient with a service animal as if the service animal is not there. Now, the ADA does not require the animals be in places or be allowed in places that represent infectious disease risk or that otherwise can interfere. So they may be excluded from food handling in a public place. They may be excluded from the operating room at a hospital, because there is some risk. You can't put a service animal in scrubs and a mask.
Correct.
But it does not require entities to modify their practice, procedures, services provided to the public. So you don't need a special access door or a special place to have the animal rest. But basically, you have to permit access for that person with the dog. It does not overrule legitimate safety concerns. For us, we'll talk a little bit about that, what that means for EMS. But the quick answer for us might be you are not required to take the animal in the ambulance with you if having the animal in the back it would interfere with patient care. I would advocate that in most circumstances that's not the case. There's space for the animal. And then you cannot refuse an animal or a person based on the breed of the dog. So if your community has a prohibition about ownership of a certain type or breed of dog, the ADA would exclude you from enforcing that for that handler.
Correct. And I've run into that. So my service dog, her name is Raffi, and she's a German Shepherd Belgian Malinois mix. So she's 65 pounds, and she looks a lot like a Belgian Malinois. And I worried about that initially. But since December, I've had zero issues with her at work. And just to circle back around to what Dr. Zeeb said, so I'm the inspector, one of the inspectors at Violet Township, so 1,100 commercial buildings. I don't take her into Kroger's deli area, or I don't take her into commercial restaurant kitchens to do inspections. I'll either leave her in the car or my colleague Joe will go take care of those items. So, for me, it's all about the success of the project. So I don't overpower her into areas where she may not be wanted. It seems to work for us. And the breed of the dog can be intimidating, but based on her breed, I've not had a single issue.
When can you exclude it? This is really your only time you can exclude the animal. Is if the dog is out of control and not handler. Handler does not take action to control it. Or if the animal is not housebroken. So the animal is expected to be able to manage its bowel and bladder function and not cause issues. And the dog has to be controlled by the handler or controllable by the handler. And I think in some circumstances that might include a muzzle.
Correct.
So,
Correct.
But if the dog is controlled and in control or under control of the handler and it's housebroken, we cannot exclude that animal.
That's correct.
So when might you see a service animal? And here are some examples through the ADA. It could be a dog trained to detect onset of seizures and help a patient remain safe during a seizure. I've seen that quite a bit lately. Most of us think about having a dog as a guide dog. That's for most of us what a service animal represents. But seizures are an issue. Patient who is diabetic and the animal is trained to alert the patient when their sugar is too high or too low. Again, guiding a blind patient, that's what we think first. Alerting patient who is deaf and calming a patient with PTSD or anxiety. So these are the kind of the common examples, but there are other things out there where you may have somebody who's wheelchair bound and they need the animal to retrieve something for them. What else can you come up with, Barry?
That pretty much hits them all. I think the seizures and the blood sugar, the huge ones that you see out there, probably more so than any of the rest of them. But I think the PTS and anxiety, we're going to start seeing more and more of that going forward.
And I think, Barry and I talked about this earlier, anxiety is going to be a tough one for us because there are some patients who have comfort animals because of anxiety. There are other patients who have service animals because of anxiety, and the difference is the training and what their role is. So we have to keep that in mind. That one's going to be a tough one in the future.
It will be.
What is a comfort animal? Comfort animals really support animals, therapy animals. They provide companionship. They relieve loneliness, sometimes help with depression, anxiety, and certain phobias. But again, the key point is they do not have special training to perform tasks that assist people with disabilities. And comfort animals are not limited to dogs. They can be just about anything. And they do not have the same standing under ADA as service animals. So keep that in mind. In a couple of minutes, we'll talk about what you can ask about the service animal. But essentially, comfort animals do not have the same. They're not seen the same way as service animals. So how about Ohio's laws? Ohio laws really can be more restrictive than Ohio, more definitive. In Ohio, we're allowed to have animal assistance, and it's has more expansive definition of animal types. And basically, an animal assistant in Ohio is any animal which aids a person with a disability. So it could be a dog, again, alerting person with hearing impairment, visual impairments. It could be a monkey that collects or retrieves items for a patient with mobility impairment. And it also defines an assistant dog, which is similar to ADA. So it really comes down to some extent, which is the more stringent standard. If somebody has an assistant animal that's a monkey in Ohio, you're probably going to have to follow through on that. But again, the definitions come down to this animal receives special training to assist with the patient's disability. Most of us, though, really look at more from the perspective of service dogs and look at the Americans with Disability Act through the feds. It's very rare that you're going to find a monkey out there that's a service animal or an assistant animal based on the Ohio standards. Well, where can you exclude a service animal, service dog? If again it's present, if their presence is prohibited. Yeah, my spelling is terrible. If presence prohibited by public health rules, so like a swimming pool, not a swimming poot. I don't know where my head was on this one. That's what happens when you write these up at 4 o'clock in the morning. So if the public health rule says animals are not allowed in the pool, then the animal's not allowed in the pool. Shopping carts, seats, and at restaurant tables. If the animal is at the restaurant, then they're as a service animal, they're allowed at the table, but they should be under the table. They shouldn't be sitting in a chair, and they shouldn't be eating off the table, and you shouldn't be feeding them off the table. And then certain areas of hospitals, such as the operating rooms and so on. So again, public health rules would really preempt. There are also a couple other circumstances where the ADA doesn't apply. For instance, the VA system's under a separate set of rules, but they have their own rules on service dogs. Probably not a worry for us. And same thing with airplanes. On airplanes, the FAA covers all that, and they have their own separate rules. But for what we do in our world, it's the ADA that covers what we do. So who's responsible for the care and supervision? The patient. and the patient is responsible. Covered entities, us, we as providers, are not obligated to care for a service animal. But again, sometimes common sense has to rule as well. These animals are expensive to train, and if the patient is not able to provide the oversight required because of their medical illness, then we should make some attempt to protect the animal and find a place to care for that animal until their handler is able to control the animal again. So what can you ask? Or do you have any questions or comments about it?
No, I was just going to say, if there's an instance where the patient is not responsive and you're not sure what to do with the service animal, I don't know that I would leave it back in the home. So we've done this on a number of occasions where we have transported the animal either in the battalion car, I know in the prevention car I've done it now twice, to the closest veterinarian, and then they house the dog until the patient can regain their health or the next of kin is notified. We have done that. Now I've done it 3 times, and I know that the other shifts have done it as well. So you might want to consider taking the dog. Like Dr. Zeeb said, these are very, very expensive animals. So we want to try to provide the best possible scenario for the animal as well in the meantime while their handler is out of commission, so to speak.
So as a handler, what are you advised to do when you receive the dog? What are they? Are you? Is it suggested you have contingency plans?
Yes.
Things like that?
Oh, yes. Yep. And so everyone here knows that if something happens while I'm here, where she's supposed to go. So she's supposed to go to Cross Creek's animal right up here on Hill Road, which is where her vet's at, and they can house her there. I've taken them down to Diley Animal Hospital as well. That was not a service animal. That was a fire, and the dogs needed to be checked, so we took them there. But, yeah, I mean, if a service handler or if a handler has a dog, they should have a contingency plan on what to do with the animal. And hopefully there's family or friends there during this time that can say, hey, we'll take him, or hey, he really wants the dog to go here, or we'll take care of it, or something other than just leaving them.
So what can you ask about the service animal? And there are really just 2 questions you can ask. Is the animal needed because of a disability? You should expect to get a yes or no answer. You can't ask the patient, or ask them for justification or what is your disability and so on. And then what work or task is the animal trained to perform? I think if they tell you the animal is to check my blood sugar, you have an idea what the disability is. You cannot require documentation of the disability. You cannot require an ID card or training documentation on the animal. So if somebody says it's a service animal, you have to believe them. And you can't ask for a demonstration of the dog performing its work. So it's pretty much you have to take things as advised by the handler. So really, in general, others cannot ask specific questions about a disability. I would suggest, however, that clinically relevant questions regarding disabilities can be asked if you have a need to know because of the medical care you're offering.
Correct.
So if the patient says the dog is trained to sense hypoglycemia, then you, I think, as a medical provider, can ask legitimate questions about, tell me about your diabetes, what has your blood sugar been, how often do you have hypoglycemia, do you have any complications of diabetes? So I think we do have some advantage by being medical providers, but our questions regarding the animal and their function and the handler's disability have to be based on medical necessity to know.
Correct.
So if you need to know because of medical necessity, ask the question. If you just have an interest, you just really want to know what this dog does, that's really not an appropriate question.
Correct.
The handler may offer it to you, but we can't ask those kinds of questions.
And most of the time, I've found that when people ask me questions that they're technically not supposed to ask, I answer them. I have no problem answering the question. Some people will, and as Dr. Zeeb said, they're not required to wear their vest. There is no specific, if they do wear a vest on the dog, there is no specific color. They don't have to wear it. They don't have to provide you anything. I carry mine with me. I have an ID, and she has an ID, and I have all the paperwork with me at any given time so that anybody were to ask or demand it, And I do that because of while I'm working. I mentioned earlier, if I want this project to be a success, I've got to be completely transparent. So if I'm in the field with her and I'm taking her into businesses and somebody wants to ask me a question, I'm completely transparent with them. And I've taken that into my off-duty roles as well. It really doesn't bother me. And to be quite honest with you, the only time I've ever been asked about the dog since December is I had to have some clarification with United Airline. Traveling out west with her later on this year, we purchased the tickets, and I wasn't sure how that worked with her. I called United, and I had to fill out a specific paperwork, FAA based. I think Dr. Z mentioned that earlier, and emailed it right back to him, and she was approved, and it worked out just fine. We had no issues with that.
So one of the questions is, must EMS transport a service animal? And really, in general, the answer is yes. Again, we're talking service animal, not comfort animal. We should make other arrangements for the animal. If space in the ambulance is crowded, the animal would interfere with the crew's ability to provide care. So let's say you have a patient who's clinically unstable, you have 3 providers in the back, and there's really not much space. Well, then it's reasonable to think about, should the service animal be left with some other responsible person. I think I would also suggest that if the patient's that sick that you have 3 providers in the back, then the handler is not able to manage or control the dog, in which case the dog should go with someone else who could safely care for them. And again, keep in mind the animal must be under the control of the handler. So if you have, our average transport where the patient is awake and able to handle the animal, there's really no justification for not bringing the animal with you.
Correct.
Now, if the animal, though, is uncontrolled, let's say the handler can't control them, the animal has been biting at the crew members, then the animal's not under control, you have no obligation to transport. I would make sure I would document that in the medical record as part of your narrative. And again, I think the last call I got had to do with a comfort animal. The dog actually bit somebody, and it was like, we're not transporting the animal. It's not a service animal.
It's not a service animal.
Bottom line, for me, and jump in here, Barry, if you disagree, EMS and commercial entities must treat a person with a service animal or animal assistant, based on Ohio rules, as if the animal was not there. The person who has the service animal should receive the same courtesies, the same service as any other public person. Again, unless there's some exclusion rules like healthcare rules and so on, or public safety rules, and unless the person cannot control the animal or the animal is not housebroken. I've yet to see a service animal that was not controlled by their handler.
Correct.
Anything?
No, and I think the $1 million question a lot of people have is, well, how do I know? If I can't ask the questions, I can't ask, is the dog trained? Do you have an ID? The dog's not wearing a vest. How do I truly know? What I will tell you is that you'll know. I mean, there's zero doubt when you look at my dog that she's not a service animal. Their temperament is different. Their behavior is different. Again, I talk about training with her for 3 months. I did that in uniform, so when I'm in uniform, she knows that, and that's work day. They just know. They're trained that way. It's the training that they've had to be a service animal. You'll know if it's a service animal or not. And I go to OSU quite frequently for some medical stuff, and whether I'm sick or not, she goes with me, and she doesn't act any different even if I am sick or I'm not sick. So to say, well, they're going to get hyped up if the handler is really, really sick, no, they don't do that. That's not how they're trained.
All right, so let's finish up with the cases I threw out there. So the first one, I'm going to let Barry give me his response. So the first one, patient with dyspnea, dogs at the side. Patient states it's a service dog and he wants it to go with him to the hospital.
In this particular case number 1, I would say yes. The patient's awake, complaining of dyspnea. There's a dog at his side. Again, patient states it's a service dog and wants him to go to the hospital. I think you have to treat this as a run-of-the-mill, everyday service dog run where that dog is an extension of the handler, and as long as the dog fits the criteria set forth by the ADA, which we've talked about, and or your governing body's rules and regulations, I think you're obligated at that point to take that dog with you to the hospital.
I agree.
Perfect.
Case number 2. You're about to take a patient to the ED, and the patient asks to take their comfort cat with them.
No.
Yeah.
It could be a comfort in any animal, and the answer should be no.
Correct. Yeah, I didn't say this was an assistant animal under
Right.
the state of Ohio.
It's
I don't know how. Cats are so freewheeling, I'm not sure how much they can assist you with anything.
Comfort cat's no different than a house pet.
Yeah.
You know, we're not in the business of transporting house pets with us to and from anywhere at this point. Based on, unless it's in your governing body's guidelines to do so, which I don't think will happen.
Yeah, I don't think so either. I mean, it might be reasonable to secure the animal before you leave the house.
Correct.
But I don't think we should take the cat. The last one, a patient is hit by a car in the crosswalk and unconscious. They have a service dog, as well as a friend who is with him or her, and the service dog and the friend are uninjured. The EMS supervisor asks you to take the dog along to the hospital.
You know, that's a tough one. So that kind of splits case 1 and case 2 right down the middle. Personally, I think that's a great time for the EMS supervisor to transport that dog somewhere, but perhaps not to the hospital. If the patient is incapacitated, you have to switch gears. And then we talked about earlier, securing the service animal somehow, some way. I don't think the dog at that point needs to go to the hospital. Maybe somebody could take that to a veterinarian or a friend's or a neighbor's or somebody. If you don't have any of those options, you know, it's in the middle of the night, the vets are closed, the friend doesn't know who the injured person hangs out with, eventually the hospital is going to figure out family and friends, and at that point you really have no choice other than to transport the dog. But I think that's a tough one.
Yeah.
I think that could be broken down a couple of different ways, depending on what the comfort level is of the crew as well.
Yeah, so the way I look at it is the patient is not able to handle the dog. So unless somebody else goes with you to the hospital that can manage the dog, I would leave the dog either with the friend if they're willing, or EMS supervisor, or someone to find a place for the animal. The friend may be the best option depending on the relationship. But I think the worst option in this scenario would be to take the patient or take the dog with the patient to the hospital, because there's nobody to control the animal.
Correct.
And if the patient's unconscious, there may be 3 or 4 guys in the back of the truck, which makes space an issue.
And if they're injured and go to the OR,
yeah,
the dog, you have to find something to do with the dog, and the hospital staff doesn't. They can't deal with that.
I think in this case, the service dog is probably best off with the friend, and if that's not the option, then EMS supervisor working on a way.
They'll figure out something.
And this
There's numbers.
We talked as part of opening comments about, a lot of this topic, it needs to be covered by the individual EMS agencies. Part of each EMS agency's procedure or protocol may be to identify a location where the animals can go. 24-hour vet center or something.
Correct. We have a 24-hour vet center in our district, so that makes it kind of an automatic default if it's in the middle of the night. I can't speak for all the agencies, but I bet there's somebody in their district somewhere that could take the dog, or the EMS supervisor takes them to MedVet or something like that that can perhaps house them. It's an individual department standard that would have to be set up. We're just kind of spoiled because we have a 24-hour vet.
Yeah. It's all about knowing the resources in your community.
Absolutely.
Well, that's it for our conversation. So thank you very much. If you have any questions, please send them to me via this email, or that's the wrong email. So I am really, send it to me via Basecamp. That's probably the best way. And I'll have to fix this email on there.
And if you have questions for me, Dr. Zeeb can forward them to me, and I'll get them answered or get you my contact, and you can call. So I appreciate it. Thank you.
All right. Thanks, everybody.